So let's look at how a hypothesis test works in statistics using a very simple example. Let's say that we know that the mean value of body weight of the population of dogs in England is 15 kilograms. So mu is 15 kilograms. And we want to know if a random sample of this population is affected by a drug we give in our clinic. Now, hypothetically, our clinic's catchment area is the whole of England, and there's no reason for us to believe that we accept more cases from one area of England than another. So we take this random sample of our patients, and we find out that the mean value of the body weight of these patients is 12 kilograms. Now, how do we test whether this mean value is different than the mean value of the whole population of 15 kilograms? Well, first of all, we can say it's 3 kilograms less. But is that due to a normal variation? Is it because we just happened to select a sample that had a value of 12 kilograms? Or is it because actually the medication had an effect in the body weight of these animals? And the way the hypothesis test works is they test whether it is probable that from this population here, we can take a random sample that has a mean value of 12 kilograms. And the test calculates the probability that that may happen. Now, if the test finds out that the probability is very, very low, then we will conclude that it is very unlikely that this sample of dogs with a body weight of 12 kilograms is part of the whole population of England, which means that is part of a different population, i.e. the population of dogs that received this drug, which suggests that the drug actually had an effect on these animals. Or in other words, it suggests that there is a statistically significant difference between the body weight of the animals that received the medication than the body weight of the animals that did not receive the medication. Now, let's examine another example that some researchers came up with. And what they did is they examined the population of all kids, or 7-year-old kids in the UK, and they found out that the mean score of the reading test was, let's say, mu. And then deliberately, they took a random sample of the same population. And they found out that the mean score of these kids was, let's say, X. Now, it must be that if we do a hypothesis test on these two samples, the mean values would not be statistically significant different, suggesting that it is very likely, it is very probable that from this population you get a sample with a value of X. On the contrary, they didn't find that. It happened that they found that the mean value of their sample was statistically different, significantly different than the mean value of the whole population. And that suggests that it is highly unlikely that you can take a sample with a value of X from a population of kids with a value of mu, which suggests that this sample was not taken from this population, which suggests that this sample came from a different population of kids. But that doesn't make sense. And the researchers used this example to make a point. And the point is that in statistics, you can't just be testing things that don't make any sense. So if you intervene with a patient in a way X and with another patient with a way Y, you want to know why you're expecting a difference. Is there a mechanical model? So you used a plating technique in one sample, and you used a different technique to fix a fracture in another sample. Is there a mechanical model that would explain why you expect a difference? Because if there isn't, and you just thought, well, let's have a look, then you don't know how you will interpret your statistical test. And this creates a problem. And the problem is that a reader may read the conclusions of the study and may think that this is a good basis for them to change the clinical practice. Do not test things based on your intuition only. Your intuition is a very good basis to start with, but you need to have a good mechanical model that would explain why doing this or that is any different. Because if there isn't any mechanical model, then your results may not make any sense, may be nonsense. The other advice I want to make is if you're someone who reads papers, make sure you read the actual paper and not consume it. And by consume it, I mean just learning by heart the results, the numbers, the authors doesn't make you a better vet than you were before reading the paper. You may have been misled, and what you're reading may be just a type 1 error.